Hello. All right, Cindy, how are you? Are you there? Do you see your button? Adding you in. Perfect. Right on time.
There we are. How are you, Kitty?
I am well. How are you?
I'm okay. If I can put this thing somewhere that I can actually also be hands-free would be great.
Good.
Soon to be in the Bahamas, so I'm already half hot.
Good, good. So I'm happy
It's
that we
good to
could
be.
connect and contact and talk about this tonight. So the purpose of this live is just to inform people about breast tomography. You will be in the Bahamas this weekend, and you will be doing breast tomography
Yay!
screening. Yep. We have some
Yes.
people joining in. So we want to just give
Yes.
this information. We posted the event, and a lot of people asked us questions about what is tomography, how long would it take, what to expect. And I figured let the expert answer these questions. And
Good.
so as we wait for people to join in, would you mind telling us a little bit about yourself?
About myself, well,
Hmm.
as you can tell from my accent, I'm not typically Canadian. I was born in Canada, but raised in Holland. So that's where I grew up, came to Canada. Actually worked for the longest in pharmaceutical research, so kind of on the opposite field. And I guess I always say that's why I learned about preventative health. So I've been living in Canada since 1982. Um, Married a Bahamian. I'm divorced now, but still consider Bahamas my second home.
Right.
Um, Coming up with my daughter this weekend. Home is Bryland for me, right? So,
Yeah.
so we'll be doing thermography both in NASA. This time, first time we're doing it in NASA, so I'm very excited about that. I've done it twice before in Bryland, so that group is growing, so I'm really happy about that.
Okay. Okay. Great. So we have about 8 people on, and we will save this. So if you can't stay for the whole thing, we totally understand. If you can, we appreciate it. If you have any questions or comments, please feel free to jot them down in the comment box, and we'll address them. But so Cindy, could you tell us exactly what tomography is?
Exactly. Thermography, well, let's start with the word. It's kind of like thermometer, so thermo meaning heat. So it's a
Mm-hmm.
science of looking at heat, inflammation. And so in layman terms in thermography, like most people understand it best to say if I say like we're looking for hot spots and inflammation.
Okay.
Of course, if we're talking breast tomography, like right away when we talk breast tomography, we go to mammography and how is it different, right?
Yes.
So mammography is an X-ray and it looks for lumps. And most women are not aware that a lump can take 6 to 8 years to grow to show up. Also depends where, like in the upper quadrants, like we often miss things too, right? So
Yes.
thermography, because it looks, so when disease starts, like inflammation can start happening. If a tumor starts growing, it can start growing its own blood vessels, which normally we don't grow new blood vessels in the body, but in disease we do. That's something that thermography can find. We also compare left to right. So for instance, we look at each spots on both breasts. Left is compared to right, and measure the heat in each spot. So nipples should be less than 1 degree difference, periareolar less than 1.5. Somebody comes in and says, I have a lump in a specific spot. We have that on the questionnaire. If there's heat attached to the lump, then that's a bigger concern. So there is, they're looking for lumps, they're looking for blood vessels. What are the blood vessels doing? Are they dilating? Are they behaving properly? And in that, we see certain patterns, and some of them are hormonal patterns, which is really
Mm-hmm.
important because 85% of breast cancer is due to hormonal imbalance. So we want to catch
Right.
things early. So it's really, instead of waiting for lump, we are just looking at risk assessments, different risk assessments, not lumps, early on in the process. So it's an
Okay.
adjunct therapy.
Okay. All right, because one of the questions that we had was specifically, what are we looking for, right? And so you mentioned that we're looking for changes, we're looking for dilation, increased circulation, like you said, looking for lumps, and we're able to see this on a tomography screen
It's
clearly.
it's an infrared camera that picks
Mm-hmm.
up the hot heat that comes from the body. Most people would understand it best, like if you look at a movie, a war movie, and they have those guns and they see the heat of the bodies come through the walls, and that's you see that red light.
Right.
Um, that's kind of where the technology was developed, was in the wartime. And then for once they did something good with it, and so medical thermography is the science where we use the infrared camera to measure the heat that comes off the body. So it doesn't look within. So for instance, it cannot see heat around the kidneys or ovaries. It's really like to the surface of the skin that we're
Okay.
looking.
Okay. All right. So for those who are interested in coming in for the tomography, what can they expect? What's the procedure? How long would it take?
Can you still hear me?
We can hear you.
Oh, um, they can expect to be very cold, which will be very lovely in the Bahamas, right? So I always welcome people to say, come into my cold room, because we have to keep the room air conditioned between 18 and 22 degrees Celsius. Again, because we're
Okay.
looking for inflammation, like the body first has to sort of get cooled down. So when you
Right.
come in, it's a cold private room. We have to undress. There is no squeezing radiation, no machines. You sit on a stool. There's a distance, there's the camera. We cool down. Several images are taken. Halfway through, I ask people to put their hands in cold water. We do
Mm-hmm.
that to stimulate the fight or flight and see what those blood vessels are doing. And then we
Okay.
take the same images, we take images after that, and they are compared. When you get your doctor's report, you'll see the before and after, meaning before the cold challenge and after the cold challenge. And we compare what we see in those images.
Okay. Okay. All right. Um, and how long does it take?
It depends how much we talk, but usually it's about 30 minutes. I usually schedule about 40 minutes for everybody. We
Okay.
usually send you the paperwork beforehand, because it's quite a long questionnaire, so it's best to do it at home, bring it in, get scanned in at the visit. Yeah.
Okay. All right. So we had a call today, and somebody was really curious because she has fibrocystic breast syndrome, where the breast tissue is very dense. And it's challenging because a lot of us have it. I have it as well. And it's very challenging because as we do our own self-screening, you have a challenge figuring out what's lumps and what's normal breast tissue for a fibrocystic presentation. And she wanted to
Correct.
know if this would be able to tell her what's going on in the breast. Her words to me was, I usually go for a mammogram and then they send me for an ultrasound. So what's the
Of
difference
course.
between going through that? Right. So could you talk a bit more about that?
Well, fibrocystic, right, like we in the medical world will call it a benign presentation. Yes,
Mm-hmm.
dense breasts are hard in mammography. Breast, like I would say, an ultrasound is better. Again, we're still looking with dose equipment for lumps. Fibrocystic does get recognized on infrared images. And I would be talking a lot about hormones, because fibrocystic usually is connected with hormonal differences. So to understand that tomography is just a tool, and with the
Okay.
results we sit down and then we talk about what can we now do based on the results that we get out of this. Because just taking a test and then not doing anything, we're still waiting, right? But
Okay.
fibrocystic specifically, I would say cystic and fibrocystic presentations, it's first of all, yes, we will see it on your report. Second of all, I'll be talking about hormones because there's something we can do about hormones.
Okay. Okay. All right. So they come in, they do the tomography screening. And sorry, for those who are just joining, because I see we have some new members coming in, Joanna and Christine and DeQuesta, thank you so much for coming on. Heather and Francine, thank you so much for watching. Devita, all the way in Canada. Cindy's in Canada. Y'all might need to hook up. We're talking about tomography screening that we're going to have here at the clinic handling your health, wellness, and rehab. Cindy Simmons is coming from Canada to visit her second home, and while she's here, she's going to offer screenings to Bahamian women. And the reason why we think it's so important, both Cindy and myself, is because there's a very high prevalence of breast cancer in the Bahamian population. We do have a high prevalence of BRCA1 and BRCA2 gene presentation, breast cancer 1 and breast cancer 2, outside of the other breast cancers that are present, the environmental ones and the other hormonal ones that Cindy mentioned before. And so we want to educate as much as possible women in the Bahamas about what's available for them in terms of screening, early detection, early intervention. Hopefully everybody's clear, but if you're not, we're on there and we're trying to get some screening in early and direction. And so I'll allow Cindy to go ahead and talk a little bit more about once you find your readings and how would we address that from a hormonal point of view. So go.
Oh, if the hormones come up, like, I mean, if it comes up in the report or not, I talk about hormones a lot, okay? Because I just feel like it's really, really important and not something that is looked at early enough. I prefer to do the urine spot check or the saliva testing to get a good idea what your estrogen dominance is, because estrogen dominance is important. And then from there, I usually refer out to naturopaths, doctors that work with the balancing of hormones in the Bahamas. That will be Anne role, like that we'll be referring to get some help. So it's really, even though we are in preventative and holistic health, it's really important that we do these baseline tests like blood tests, the breast ultrasounds, the thermography, and the hormone testing, because if you want to start a treatment plan, it's important to know where you're at so that you can see a year from now. Like some of my patients in Harbor Island will be coming back. They've been educated, maybe made some lifestyle changes, did something about their hormones. Now we will be doing another thermography and to see if it's improved, right? So again, it is, instead of waiting for something to be really wrong, and especially in the Bahamas, as you mentioned, often it's only like discovered when people are already in stage 3. That's why I feel like breast tomography is really important over there, because we can start working earlier and preventing and doing something, which is, it's really hard when you're already in stage 3 to work backwards. Right? Like it's a lot more work. So the earlier we can do something, the better, I would say.
Right. Okay. Okay. So when they do the screening, how long does it take to get the results?
About 2 weeks. We get a doctor's report from a Canadian doctor. So it'll be about 2 weeks. I'll email you or the person. We'll set up a time to, like, I'll email the report. We set up a time to discuss it, because the report is a 4-page report, but it's a bit technical. So it needs explanation, and then we'll talk about what you can do from here on.
Okay. Okay. Good stuff. All right. So
good.
It depends on your results. That's where we go from there. If anybody has any questions.
There is a TH rating. So TH1 is the lowest rating and TH5 is so the report will have that information to kind of give you an idea of what your risk rating is. And based on that, different recommendations are made.
Okay. Okay. All right. Does anybody have any questions? You can feel free to drop them in the comment section. Let us know. Cindy's here. You can ask any questions. So talking about breast tomography, its benefits, the reason why we want to introduce it. A lot of us have a family history of breast cancer, and they tell us that once you've been diagnosed, or a family member that's been diagnosed with breast cancer, So let's just say your mother's been diagnosed at the age of 50. You need to start your screenings and be more vigilant 20 years before that. So if you're 30 years old, you should be getting regular screenings and not waiting for the other time frames that they would tell you to start. We really want to be proactive here. You know, this is something that we deal with as a oncology specialist, physical therapist. I see a lot of patients, and when we take our medical history and we're asking breast cancer survivors, when were you diagnosed? And they tell us, and like, did you have any signs or symptoms? Possibly, but they didn't act on it. And the other thing too is a lot of people wait so late to start screening, and they start screening by the time they do catch it, like Cindy mentioned, it takes about 8 years to grow a tumor. You know, if we can pick it up earlier, possibly with a tomography screening, that's a real benefit. Just think about, you know, how much time that you can save, and probably you won't need as intensive treatment. So we definitely want to educate the Bahamian public and the public at large, because this is not just for the Bahamas, about the benefits of tomography. And we really want you to be an active participant in this conversation. Francine, you're most welcome. A lot of women deal with this dense breast tissue, and they get frustrated because they don't know what they're palpating. Everything feels lumpy. And so yes, a lot of us share that issue. Okay. Cindy? Anything you'd like to add?
For me,
Yes, ma'am.
well, I'm really looking forward to doing this on Friday. Um, you know, the education, like tomography is great, but I love the education and helping women. I just wanted to, like, I also have a book, right, that I wrote, which
Yes.
kind of has to do, you know, a guide to healthy hormones, secrets to breast health, because I found like a lot of women will come for the thermography and do the tests, but then come back in a year's time and I'll ask, well, did you do all those things that I asked you to do? And, you know, they don't. So I wrote a little book that is very basic. It's called, here it is. Do you read it now upside down? Okay, well, A Guide to Healthy Hormones, Secrets to Breast Health. It's a simple little book, and you know it goes from informed consent to simple things that you can do in your lifestyle, from breakfast, drinking water, healthy habits to do. So just to sort of, I think you know people get bogged down by fear, and
Yes.
one of the things that I really try to do in my practice is give hope, because you know we're bombarded with fear all the time. So the book too is more meant as a proactive, let's have fun doing this, let's be healthy and
Right.
let's do some stuff, right? And I think for all of us, when we do things, we feel better about ourselves instead of the waiting, right?
Right. I think what I really like about this, what we're doing here, especially tonight, is that we don't have enough opportunities to share information. And one of the
Yeah,
worst things is when somebody says, "But I didn't know that this existed. I didn't know who to talk to."
that's right.
A lot of times you're in a doctor's office, a physician's office, and there's so many other things that are being addressed. The other questions that you have sometimes are left unanswered. And we want to make sure that you know that you do have resources, educated, well licensed resources in the
Yeah.
community. And that if you do have these questions and these challenges, please feel free to reach out and ask. One of
Mhm.
the questions that I got, Cindy, somebody wanted to know if she had a breast implant, would she be able to have a tomography screening as well?
Completely safe to breast implants. There's no
Okay.
squeezing, there's no radiation, there's none of that. It doesn't interfere with what we see in the breast tissue, so completely safe to come with breast implants. And a great alternative, many come with breast implants because they're kind of worried about doing mammography with the implants, right?
Okay.
Yeah.
And then I had another question. Somebody wanted to know if she's breastfeeding. Is this a safe option for her as well?
I would say if you're breastfeeding, because it's very hormonal, it's best to wait 6 months past stopping the breastfeeding,
Okay.
because your picture is just going to look very hormonal. Now, having said that, if you had to have specific issues going on or you
Mm-hmm.
have specific concerns, I would
Mm-hmm.
definitely say it's safe to do. It's just that the picture that will come up will be very hormonal, of course, because that period is a very hormonal period.
Okay. Good stuff. Good stuff. Any other frequently asked questions that you encounter in your practice in Canada?
Um, well, I mean, a lot of people concerned about radiation because it also
Mm-hmm.
um, causes cancer, right? So, a lot of people want to use this over mammography. I would say it's not a replacement of, but yeah, like educating on the pros and cons of everything, right?
Mm-hmm.
Is really, really important. And I think most people are not aware that it takes so long for a lump to be big enough to be shown on a mammography. I think a lot of women don't know that 80% of lumps are benign. So we hear lump and we faint, right? So I
Right.
think those are all very important things to empower women not to live in so much fear, because fear also causes negative things in the body, of course. Yeah.
Okay.
I think people are still scared coming for thermography too, you know, like, because we're still dealing with breast cancer, and people just, it's a fearful subject. So, I would say try and be proactive the best you can, because waiting usually doesn't help, right?
Okay. Right. Definitely. Definitely.
Hmm.
Definitely. So does anybody have any questions, any comments? Please feel free to ask. You have the expert on the line. She will be here Friday, but she would be in office and doing screening, so she may not be as accessible. Maybe the questions may come afterwards. Um, Cindy, we need to post the link to your page in this.
Yeah,
Um, and I think it's
for
at
my
tomorrow.
website, you mean?
Yep. What is it?
It's thermographyclinichalton.com.
Thermography.
Clinic
Mm-hmm.
Halton, HALTON.com.
Okay.
And also to mention that we still can take appointments, right, for Friday, Kitty.
Mm-hmm.
We still can squeeze some people in, and same for Bryland. Just contact me or you, um,
Certainly.
if you're interested.
Certainly.
Hmm.
Yep. So, so we'll probably be doing a few more lives. I can see a lot more spinning out of this because we're getting some other questions not related to mammography so much. I think a lot of more people wanted questions in terms of hormones and eating healthier for breast health. And we definitely want to do that. So like I mentioned before, my name is Kitty Adley. I'm a physical therapist. I own a private practice in the Bahamas, a physical therapy practice. We are orthopedic driven. However, there we offer specialties in oncology management and breast cancer rehab. So I oftentimes see the breast cancer survivor after the chemotherapy, the radiation, the hormonal therapy, or not just after, but during the surgeries. And I treat a lot of patients that are dealing with the side effects of breast cancer treatment. So that's the lymphedema, the pain, numbness, tingling, decreased range of motion. And we always want to make sure that we have our patients as educated as possible. And as I treat breast cancer survivors and other oncology survivors, I want to make sure that I'm working on the front end in terms of preventative care. And this is what we're doing right now. We want to educate you about being healthier, making better choices to try and decrease the risks or lower the risks of cancer presentations, and also be vigilant with screening. So if we screen, we can identify any challenges or risk factors early, and then we can definitely go ahead and do early detection and early treatment. And so this is one of the reasons why I'm so excited about having Cindy Simmons come in from Canada and offer tomography at Handling Your Health on Friday, which is August 3rd, this week. So we're here. I will put her contacts. Well, we have our website there, and you can definitely feel free to contact us if you have any more, if you need any more information. Cindy, I'll let you wrap up and just give the viewers any more information that you'd like to share.
Well, thank you all for who have joined. Please share. Like, I think the video is available after we finish, right, Kitty?
Yes,
I'm
it
really
is.
looking forward to meeting everybody on Friday and spending my day in Nassau. Um, Again, any more questions, please don't be shy to ask. Just text, inbox, whatever means. Go to my website. You can text me or email me from there. But yeah, like I'll be coming more often if I can. At the moment, I've normally come once a year, but we'll see how we can increase that to be available for Bahamian women to work with this tool. So thank you very much, Kitty, for having me, and very much for having me on Friday. And somehow I will find my way to you because I still don't know exactly where you are. I'm not so good in Nassau driving, so I'll find you on Friday, okay?
Google Maps is fine. We'll don't worry. I'll grab you from the airport. We're good. All right. So thank you so much for the time that people stayed on. Like I said, we'll definitely make sure the video is available for you to view. And yep, Francine, we'll do a thermography versus mammography. And like I don't really think we want to do versus, but we'll just talk about the benefits on our next Facebook Live. And if you have any other things you'd like us to discuss, just drop it in the comment box and reach out to us. Everybody have a fantastic evening. And just stay tuned for what we have to offer. Have a good night.
Good
Bye.
night, everyone. Night, Kitty.
Night, night.